Okay, so we had depression. Okay, depression. So is depression similar to being sad? Um, so it was noted that clinical depression goes beyond sadness. It is more than just having a bad day or a major loss.
And this is what we'll be talking about. So the diagnostic criteria is quite extensive, but it is 5 or more of the following symptoms during the same 2-week period, and a change from previous functioning, and at least one of the symptoms below is either depressed mood or loss of interest and pleasure. So the symptoms below are depressed mood most of the day, nearly every day. And that's from a subjective report of feeling sad, empty, hopeless, irritable, or other words like that. A loss of interest and pleasure in most of the activities, most of the day and nearly every day, a significant weight gain or weight loss, or a change in appetite. This is a loss of 5% body weight in a month that is like considered significant. And then reports of having to force themselves to eat is also an indicator. Insomnia or hyperinsomnia nearly every day. Psychomotor agitation or retardation nearly every day. So examples of that would be the inability to sit still, pacing, hand wringing, pulling, rubbing your skin and clothes and other objects. And then additionally, fatigue or loss of energy nearly every day, feelings of worthlessness or difficulty concentrating or indecision, and recurrent thoughts of death. And then there's also specifiers for that diagnostic criteria. So they're not really part of the diagnostic criteria, but they are characteristics that add to a diagnosis of depression. So those can be severity. So it can be mild, moderate, or severe depression. The depression can have psychotic features. It can have melancholic features, which actually means to be sped up rather than slowing down. Atypical features as well. That would be like slowing down. So an increase in sleep and appetite, but high anxiety, and then less anhedonia. And then there's also a peripartum onset. So that's with pregnancy, and then a seasonal pattern, which would be seasonal depression.
All right, so depression and how it impacts occupational performance. So depression can impact a person at any life stage and or during any special circumstances. So major life events or things that occur in someone's life that impacts them significantly. Children present depression symptoms differently than adults do. And this is mainly due to their developmental, as they have like limited vocabulary, and they can't really express themselves the way an adult would. And then psychosocial impacts, the functional mental status, so their cognition can be impacted, their ADLs, IADLs, social participation, and their leisure. So now we're just going to look at depression across the lifespan and how it impacts occupational performance. And then it is noted that during childhood, there's 1 out of 33 children that are depressed, adolescent 1 out of 8 teens, and then adult it's sometimes because of poor childhood that impacts them significantly later in life, and then therefore they have major depression. And then there's also depression in infancy because of chemical factors that influence depression. All right. So just to start out, so as infants, it's not obviously typical to see a depressed infant. However, due to chemical factors, they can be impacted. Hereditary effects, so like passed on from like a parent, environmental triggers. So like I said before, infancy, childhood, they can be depressed, and then it would just need like a trigger that first starts that major episode of depression later in life. Okay. So looking at childhood, so the early onset is children that struggle in school. This could be because of their peer acceptance, so them feeling left out, neglected by their peers, social or school experiences. So again, that social participation may hinder their childhood development and impact them later on. So their parental control expectations, so how their parents are, and what their parents' expectations are of them, which will then, all these factors will affect them cognitively. So their attention, they may have learning disabilities. So therefore, again, impacting them educationally. As I mentioned, social relationships, other stressful life issues such as family issues, neglect, abuse, rejection, also are those trigger points that could be the onset of having major depression. Again, as I mentioned, that limited vocabulary, so they express themselves differently. And then as well as play, ADLs are also impacted. Okay. So now just looking at, adolescence. So now that we've seen what occurs at childhood, so that just goes along to adolescence. So in regard to those, typically adolescents, they'll fail out of school, alcohol, drug use. It was noted that adolescents that are cigarette smokers are more prone to depression. And at this age, girls are at risk 2 times more than guys are. There's also extra stress added as you grow older. Difficult relationships, could be romantic or just with your family, friends. Loss of loved ones could be another trigger point. Abuse in any sense through loved ones, through school, sexual, any of those sorts. Chronic illness, so themselves or a loved one, which all these affect them, their social participation, their education, their leisure, hobbies, so what they do during their free time, the things they enjoy, and education twice. So ADLs and IADLs also would be impacted. All right, so now moving on to adulthood. So again, it's like a monopoly effect. So adulthood, sleep disturbances, so insomnia or too much sleep, just being tired, groggy, not performing well at work. So psychosocial impacts, irritability, frustration, outbursts on small topics. So not feeling worthy, anxious, memory, concentration loss of interest in activities and leisure activities. So sex, hobby, sports. As I mentioned, often fatigued, weight loss, weight gain, physical issues. Depressed people tend to move slower, speak slower, which all these, again, will impact them, their work, their social participation, their relationships, their health, their IADLs, ADLs, which could further impact them financially. And it's a whole effect.
Okay, so settings that an OT is likely to see a diagnosis of depression in, and then also diagnoses that are more likely to have depression. So an OT can see somebody with depression in all settings. People who are more likely to develop depression are people with chronic pain, cancer, stroke is a big one. From an article that we read, about 1/3 of people with developed depression after having a stroke. And there's also impacts on functional performance because of the depression, and their recovery because of depression, and then also higher mortality rates. Additionally, diagnoses like diabetes, heart disease, like the anxiety that comes with those diagnoses, can be particularly stressful and cause depression. And then spinal cord injuries and amputees. And that is not an extensive list. You can imagine that any diagnosis is susceptible to depression. So the impact on service delivery. Depressive symptoms must be addressed in intervention if they are present, because occupational performance and balance won't increase with intervention if depression is bringing those down and depression is affecting those. And then an estimated 20% of individuals will develop depression in their lifetime. So it is highly prevalent, and you're likely to see it in practice. Having compassionate and empathetic service delivery is important to remember. And meeting the individual where they are at and accepting them is also extremely important. Acknowledging that fatigue is normal, because fatigue is a symptom of depression and it impacts functional performance in all areas. So being sure not to overwhelm an individual with intervention is important. And then habit training is also important, and the book mentioned that, but it has to be activities that are meaningful to the individual, or it will just become a chore, and it might cause them to fall into a cycle of hopelessness and feeling like they can't get out of their depressive symptoms. Okay, so for interventions for individuals with depression, the first two that I want to talk about are cognitive behavioral therapy. So this is a type of therapy that has a focus on relationship between thoughts, feelings, and behaviors. It's evidence-based and really practical. It's really regimented as well. And OT can use this to challenge maladaptive thoughts and behaviors, and introduce meaningful activities and increase the meaning of this regimented intervention. So OTs can add to it. And then dialectical behavioral therapy is DBT. It is like cognitive behavioral therapy, but it emphasizes mindfulness, relationship, and it values the whole person rather than just focusing on their thoughts, feelings, and behaviors. And it adds an element of acceptance to cognitive behavioral therapy. And efforts to change are balanced with efforts for acceptance. We talked about these in class, so I'm not going to go super in depth with them, but those are two options of ways that OTs can bring that into practice. Additionally, through a article that we read, you can have, it was a scoping review, so they highlighted the most commonly used interventions. Psychosocial interventions, the objective was to increase occupational balance and decrease symptoms of mental illness. Other objectives include social and work reintegration. The programs could last between 3 and 9 months, so they were more short term and they weren't standardized, and they were generally done in groups but can be individual. And OTs specifically do psychosocial interventions, so other professions weren't super involved in the psychosocial intervention like they would be in the other 3 interventions. So for psychoeducational intervention, this is also not carried out by an OT all the time. Objectives would be to improve disease management, acquire significant activities and hobbies, increase social skills and communication. They are generally used with groups, but also can be individual. Cognitive intervention is the CBT and DBT. It's often used by OT, but not exclusively. It is used to improve cognitive function and to think about how thoughts affect a person. And this is also usually done in groups, but can be individual. And then exercise intervention is less frequently used, at least in the scoping review it was. It's usually carried out by a multidisciplinary team, and the objective is to compensate impaired cognitive skills, work as part of a team. And this could also help by creating a hobby and then improving feel-good hormones. And another article that we used looked at the effectiveness of OTs in the management of depressive symptoms and the perception of people who are participating in groups, which are aimed at decreasing symptoms of mental illness. And the article said that OTs were highly helpful in creating coping skills and decreasing symptoms of depression. Clients in this review looked at improved mood, learning coping skills, regaining self-esteem, and becoming part of a solution to face life's challenges. And participants in the groups noted improved mental health and improvement in all of the areas that they were looking at. So then, speaking of multidisciplinary teams, psychiatrists would also be a part of a team. They would prescribe meds and ultimately make the diagnosis. Social work could also be a part of the team. They would connect people with resources, and they may manage family, financial, and housing concerns if needed. And then cognitive behavioral therapists or behavioral therapists in general might also be involved in a team. And working with a behavioral expert can help you as an OT focus on occupation rather than having like a large focus on behavior, but you can still have those behavioral aspects within your own therapy. And then other more general interventions are offering strategies for energy conservation and reducing fatigue, adding structure to an individual's day and making sure their day is structured with meaningful activities, which kind of goes back to the habit training. Having habits that aren't meaningful isn't creating a good habit. Building confidence and self-esteem will also be a part of intervention, and then improving motivation through small and achievable goals to increase that self-esteem and build that confidence is a way to do that. And then finally, vocational support is also super important. Looking at job demands, making alterations to jobs, and promoting performance within the job is a thing that OTs can be involved in exclusively. And another article that we found concluded that OT is very effective for return to work interventions. And it's a major area of need that OT would be valuable in because not a lot of other disciplines look at that.
All right. Okay, so the pharmacotherapy, we just wanted to talk about this too, about the medication that a person may take if all other intervention plans fail. So depression is linked to neurotransmitters in the brain, and there still aren't in 2019, it was just still unclear on how the medicine improves your mood and how that works in your brain. However, the two types of different neurotransmitter blockers are the monoamine oxidase inhibitors, which raise your levels of monoamine. So those happy feelings, so serotonin, dopamine, and all those neurotransmitters. And then there's the SSRI, selective reuptake of inhibitors, which just raise the serotonin. This one is often used to treat just because it has less negative side effects. And then, so why should we care? So suicide is the third leading cause of death between ages 15 to 24-year-olds. And then suicide is the sixth leading cause of death between 5 to 15-year-olds. And then depression can further affect a person economically. So it was noted that there's a monopoly effect. So impacts like many people and impacts their occupational performance, which then further can affect them financially, which would then just dig them a deeper hole into depression, and then it would be difficult to come out of there, especially if you don't have the financial means to receive the treatment, get therapy, get medicine, anything along those lines.
So then these are our quiz questions. The first is, how does a diagnosis of depression impact a person functionally? And then the second is, how does depression differ from general sadness that a person may feel? And these are our references. Thank you.